Hi, I'm Dr. Erin Ducat with Ducat Chiropractic and Sports Medicine. Today I wanted to teach you how to assess your breathing and see if maybe you have a dysfunctional breathing problem, which could be causing problems in your neck, your upper back, or even your core. So in order to check your breathing, you want to lay down on your back, just like this, okay? Ideally on a flat surface, firm surface like a floor or a yoga mat. But if you can't get on the floor, you can also do this in bed too. You also want to ideally straighten out your legs. Okay, when you have your knees up like this, it really changes the angle of things here in your core. So it's better to have your legs extended like so. Next, you can put your one hand here in your abdomen and then the other hand on your chest. And take a couple of breaths and just see what's moving. Is it your stomach or your chest? So I'm going to show a couple of breaths here with a normal breathing pattern. So as you can see, my abdomen was rising and going down. It would rise as I was inhaling, go down as I'm exhaling. Now I'm going to show what we call a paradoxical or dysfunctional breathing pattern, where your chest actually rises instead of your abdomen when you inhale. Can you see the difference between those two patterns? So ideally, when you inhale, you should feel a rise here in the abdomen, not the chest. The only time you should be chest breathing is when you're in a really anxiety-driven situation or you're running from a tiger or sprinting at the end of a race. Other than that, all your breathing should be coming from right here. After you check if you're a chest breather versus abdominal breather, I want to show you another kind of higher level test that you can check. So when you're an abdominal breather, you also want to make sure that you're expanding 360 degrees through your abdominal cavity. So that means there should be lateral expansion in your ribs and also expansion into the ground, into your back. So to check this, you can make kind of like a C shape with your hands, put them here in the lower part of your rib cage, and again, take a couple of breaths. If you're breathing properly, you should feel your hands expand out to the side and actually open up in the front and back. So that 360 degrees of expansion. If you feel that the expansion is just here in the abdomen, you can actually use this position as an exercise to practice that lateral expansion. Just take your hands, really squeeze the rib cage tight. As you breathe in, try to push the hands up. It's a great tool to just start learning how to get that full expansion of your lungs. And this also helps strengthen that diaphragm muscle. Your diaphragm is actually the largest muscle of your core and a very important muscle to make sure you've got good strength and endurance in. So if you have any more breathing questions or wondering if maybe your dysfunctional breathing is causing you problems, feel free to contact me and check out my website. It's www.ducatchiropractic.com. Thanks.